Hello? Is anybody on?
This is Jared.
Yep. Oh, hi, Jared.
Hi.
Yep, this is Lisa in Alaska.
Hi, Lisa. Nice to hear your voice. Lisa, while we're waiting for everybody to get on, can I ask you a question?
You bet.
We've recently heard that Val maybe is not at Cosaboo anymore. Do you know?
That is correct. He retired at the end, I want to say the end of April.
I'll be darned. Do you know who the new administrator is up there?
They do not, they haven't shared if they've got an interim or not, so I don't know.
Okay. Wow.
This is Ron.
Hey, Ron. If you found out, Lisa, because we really need to reach out to all the nursing homes up.
I'm emailing my contacts while we're on the line.
Thank you so much.
And who was that, Tammy? Lisa who?
That was Lisa.
Lisa Johnson. I'm with the QIO in Alaska. Okay, thank you.
And this is Jessica from USAC on the bridge.
Oh, hi, Jessica. Thank you for being our speaker today.
Anytime.
Tammy, you let Jessica know when she's ready to talk. I told her she had 20 to 30 minutes. And then also, she has some slides, but I think, are you going to send those, Jessica, to Julie or me?
No, that's okay. I'll do that later. I can.
Okay.
It's fine. Yeah.
Okay.
Okay, well, I'm going to go ahead and call this meeting to order. Susan, could you please do the attendance?
Okay, Ron here.
Yes.
Tammy. Myself. Lisa. Jesse. Debbie.
Yes, I'm here.
That's it.
Ina. Is Lee
Jared, are you
on?
on?
Yes, I'm on.
Thank you.
Jared, okay.
Lee?
I have it.
Leon?
No.
Oh. Okay. So we have a guest speaker today. Is Jessica Zufalo?
Yes, that's right.
Okay, well, we welcome you. We'll try to get through our business so we can hear from you.
No worries. Take your time. I'm just glad to be with you all today.
Oh, thank you. We were just on our board of directors call and talking about the grant report. So, yes, Ron, I'll let you just do a brief update for Lisa and anyone else that might want to know where we're at in it.
Okay. Well, U.N.I.T.E is very interested, and we've been working diligently on putting together a proposal for the grant that ACL has submitted. It needs to be in by the first part of July. We're hopeful to get our proposal in next week. It's basically being a resource center for the different tribes and to assist them with their assessment as well as development of long-term services and support. And U.N.I.T.E put a committee together, and they've been meeting weekly, and Jared Denton from Native American Health Management has been the coordinator, and we've been sending the drafts to all of our board members for their input and review, and we've gotten quite a bit of input, and so that input's been incorporated into our proposal, and we're hopeful that we'll be selected by ACL.
I want to thank everyone on the grant committee because I know you guys have put in a ton of time, and it's really appreciated. So I just really want to acknowledge all of you that's worked hard.
Thank you.
Anybody else have any questions regarding grants? So I'll move on to the executive director search. I believe we have the job description completed. We needed to vote on it. So when we get back to our board of directors meeting, that's one of the things we need to discuss. We briefly discussed having an office in Lincoln. So we need to, I think, probably take a vote. So we have a few more items, but I think we need to vote on and then see what direction everybody wants to head. But I think we're moving forward. Anybody have any other questions about the executive director?
No, it's just exciting to see things start to get a little more formalized.
Yes, yes it is. There is. And so, Debbie, I'll let you talk about our Leading Age Conference again.
Okay, no problem. Thank you for all the members for being on the call. So we are working with Leading Age. We've had several meetings with their executive director, Katie Sloan, thanks to Lee's contact, and we've been able to put together a memo of understanding that I think we've all agreed on at this point, and so there will be a meeting hopefully early next week to kind of solidify that. In the meantime, we were looking for a place to have our annual meeting, which we usually have in the fall, and so we were able to get Leading Age, gave us some staff, and we've been working with them. And so our annual meeting will be on Sunday, October 27th, which is basically the opening day of Leading Age. It is in San Diego, so hopefully everyone will be able to come. Registration is now open. U.N.I.T.E has a link on the Leading Age registration page where you can go through and get a Leading Age member rate because you are a U.N.I.T.E member and work with U.N.I.T.E. So we understand that our membership structure isn't set in stone at this time. So as long as you've at this point been working with U.N.I.T.E and part of U.N.I.T E, you're good to go to get the member rate for our annual meeting and for the Leading Age Conference. The conference goes from Sunday the 27th through Wednesday the 30th. It will be over by Halloween. And we will have a booth. We will have a hotel designated for U.N.I.T E members. We will have a lounge set aside in the conference center area. And they will provide lunch for us on Sunday and also the IT that we need for the conference. So it's really a win-win, and I'm really excited about this partnership.
Thank you.
Mm-hmm.
I think it's exciting to go. I mean, we've always attached our meetings with different conferences, and I think it's exciting to me to go to something new, what we can learn from there.
And Leading Age has a great reputation.
I just think it sounds awesome. So if there's no other questions for Debbie, then we'll move into new business discussing our best practice report.
Okay, do you want me to do that?
Yes, please.
So we did have a call yesterday, Monday, with Kaufman and Associates, but I did send an email out to all the board members to kind of update everyone on what's happening. We are trying to get a person to be interviewed. Let me go back. So last fall, we have to do 4 best practice reports a year with CMS as part of our being on their website. And we agreed to discuss trauma-informed care, which is coming up for nursing homes in phase 3. And so we did a real nice one, and that is on cms.gov. The second best practice report was actually an infographic that Kaufman and Associates put together. That is not yet on the cms.gov website because they had some issues with the tech part of that. There was something going on. And then the third one, because we just didn't get our times together, they actually updated the tribal assisted living list, the directory, so that will also be on cms.gov. I don't believe it's on yet. Julie said they were working on that. And so this is actually our 4th best practice report. We do want to go back and be true to what we said we were going to do, which was our trauma-informed care. And so we decided to actually interview maybe a couple of tribal social workers. We want someone, and I have a potential contact, but I certainly would like more names for someone who maybe works with tribes on historical trauma. We'd like to interview that person. and do maybe 5 or 6 interviews, and then KAI will put together the 4th best practice report. So it would be very specific to how trauma-informed care is actually like when you talk to a resident, how do you, talk to them about the trauma they've experienced in their life, and then how is that implemented and put into the care plan and really incorporated into the care that they get when they're at the facility, be it assisted living or a skilled nursing facility. So we're looking for those people. These interviews have to be done within the next 3 weeks, because KAI has a 2-week turnaround time, and they have to have it up by August 1st. So we're getting close. So please, if you're willing to be interviewed or you know someone, please send me that contact information. And then we are still doing one more webinar. I'd like to thank everyone who did the long-term support service webinar in May. Thank you to all who participated. Also Dana Schlegel from the rehab hospital up in Flagstaff, Arizona, who participated. Appreciate all that. And then we are doing another one in July. It's the 4th Wednesday, which I believe is July 23rd. We've already scheduled a dry run for that simply because we're getting so close. We need people to volunteer to be on that webinar. We agreed at our annual meeting last year to talk about kind of where we were as a collaborative, because we knew there were going to be some changes and transitions. So this webinar probably won't be super long, but there's going to be time for people to ask questions, to say, hey, who are you guys again? And what about this and that? And maybe get some feedback from tribes just in general. So it's a wonderful opportunity for us to tell people who we are, what we can do, what we want to do, and maybe get even some feedback from them as to how we can proceed in a way that most benefits their tribal elders. So this is a great opportunity. I really encourage those of us who have been really engaged and active with U.N.I.T.E to be on that webinar, to be a speaker, because we really need that expertise. So please let me or Julie Cousin know as soon as possible on that.
Okay, thank you. I have a couple people that I think would be interviewed, so I'll send you their names.
Thank you. I appreciate that. And we also talked about maybe getting Dr. Winchester. I still have to reach out to her today.
I hope she'll do it.
Yeah, me too.
So, is there anybody right now that wants to just volunteer to be on it?
This is Ron. I'm willing to work with whoever on that webinar.
Okay.
Thank you, Ron.
And if you need me, Debbie, I'll do it.
Thank you, Tammy. I appreciate that. I think our leadership would be really good because,
Debbie, this is Lisa. If you need me, I'm in too.
Nice. Thank you, Lisa. I appreciate that. Anyone else?
What is the date again?
It's always the 4th Wednesday of the month, so it's going to be July. I think that's the 23rd. Yeah.
24th. Yeah.
Oh, I'm sorry. It is the 24th. That is correct. And also we tentatively scheduled a dry run for Tuesday, July 16th at 12 o'clock. That would be 3 p.m. Eastern time, 12 o'clock Arizona time. We usually do a dry run the week before, but we would also probably need a call just to kind of talk about what we're going to talk about. So you're looking at probably maybe 3.5 to 4 hours of time commitment to pull this together.
I'll wait to hear from you guys on what you need us to do.
Is Joseph Ray on the call?
I don't believe so.
Okay.
There isn't anyone from KAI on our call either, is there?
Jonathan's here.
Oh, hey, Jonathan.
Oh, Jonathan's on? Oh, good. Thank you.
Sorry, Jonathan. Was there anything else you wanted to say? I should have let you kind of talk to about that.
No. I mean, you covered everything. Just want to make sure that you let Debbie or I know who wants to participate in the webinar, so we can send out the invite for the dry run and any other calls that we have relative to it.
I would think, Jonathan, we probably need to identify the speakers before the end of the week, or, I mean, when would be, you'd like that probably wrapped up this week, right?
Ideally, yeah, it would be great if we could have them this week.
Okay.
I mean, I wrote down Lisa, Tammy, and Ron as of right now.
So it'd be, right now we've got Ron, Tammy, myself, and Lisa Johnson from Alaska to QAO. So there's 4, but we probably need at least one more person, if not 2.
Okay.
Susan, can you be on that webinar?
Sure, I will.
Okay.
And Debbie, I'm going to ask
Susan.
my social services manager if she would be on it. She's really good.
Now, this is to talk about U.N.I.T.E, like kind of the history and where we're going. Are you talking about more?
Oh, I was talking about the.
Yeah,
no,
you're
I was
talking about the best
webinar
practice report. Yeah, I'm talking about the July webinar. So,
Okay.
Susan, I'll put you down for that, but I'm going to reach out to Joseph and see, and then I'll get back to you, Jonathan.
Okay, that sounds good.
Okay, thank you.
And then also, going back to the best practices, if we could identify the interviewees by next week, that would be great too, just because of timing.
Yep, by the end of next week. So, Tammy, send me those, or just send them directly to Jonathan if you want, and CC me if you want to do that.
Okay.
Okay. Okay.
Okay, any other information about that? Then we'll move on to our guest speaker, Jessica Zufalo. She's the Senior Advisor for Strategic Partnerships of Lifeline. Welcome, Jessica.
Thank you so much. Appreciate it. Can everybody hear me okay?
Yeah.
Assuming yes. Okay, terrific. Thank you for inviting me. So I wanted to give you guys a little bit more information. I had a chance to participate in a conference, I think with a lot of, some of you perhaps, a couple of months ago, and really only gave a very high-level overview of what we're doing at U.S.A.C, but I wanted to really give all of you a deeper dive into the program changes for the Federal Lifeline Program and really talk about the intersection of the work that we do at U.S.A.C with all of you. So the Universal Service Administrative Company is a quasi-federal nonprofit. It administers $10 billion every year in federal subsidies to schools, libraries, hospitals, as well as low-income communities in rural and urbanized areas. It also finances the cost of broadband build-out in rural and tribal communities as well. So it is a really important financing tool to help underserved communities get the sustainability they need to succeed and to receive connectivity support. Unfortunately, there's an echo in the phone. I'm not sure if folks could put their phone on either mute or I'm not sure, but there's a bit of an echo. Anyway,
let's all do that. Yeah, everyone put their phone on mute. Thank you, Jessica.
Sure. No, I run so many conference calls. I'm sort of used to this kind of stuff. So anyway, I wanted to share with you all the information about the Federal Lifeline Program and what we're doing in Indian country to get more consumers the benefit. The subsidy is essentially a $34.25 per household per month subsidy for consumers who live on federally recognized tribal lands. For those that do not live on federally recognized tribal lands, you are eligible for up to $9.25. So for those that live on tribal communities, on tribal lands, it's a terrific benefit to subsidize the cost of your monthly cell phone plan and either voice or your internet, either in the home or mobile. So it funds either mobile or fixed. And it's a really important piece to communities across Indian country because there's so many communities that have no ability to afford phone service otherwise. I'm going to try to switch my phone here so you can hear me differently. So I wanted to talk a little bit about how you can apply for the Federal Lifeline benefit. And stepping back a bit, just to remind everybody, the Universal Service Administrative Company is essentially the back office administrator to the Federal Communications Commission, who establishes the policy for all of the work we do. So the Lifeline program, the E-rate program, the Rural Healthcare Subsidy Program, and the High-Cost Universal Service Program essentially are just subsidy programs to help underserved communities get connectivity for schools, for libraries, for hospitals. And in the case of the Lifeline program, it's a subsidy that goes directly to the individual customer. And USAC administers the money, administers the programs. We handle program integrity, and we handle the operations of the program, but we don't set the policy. So a lot of the rules and requirements that I'm going to talk about are established by the FCC and not by us. We try as best as we can to use the rules that are given to us to really push out the benefit to as many people as we can, because we know the needs are so great. So going back, the Lifeline program started in the 1980s under President Reagan, actually, and it is a subsidy program that essentially helps communities, low-income consumers who are on public assistance get phone service. And about 15 years later, the FCC expanded that from voice to internet. So you can use the subsidy for internet service in your home, or you can use it on your mobile handheld phone for like a smartphone for a mix of voice and data minutes. The subsidy is not allowed to be used for the actual device of the handset. It's just for the service. And the way it works is when a customer applies for the program, they can either do so through their phone company, or they can go directly to us to apply for the benefit. We have a portal on our website for consumers to apply to really help consumers know that they have choice, and they don't have to just go to the phone company in their area. If they want to really vote with their feet and choose the service provider that they think is, if there is a choice, even if there's one that exists in their community, we really try to make sure that they have the ability to make a choice and not be tethered by one phone company. And so the subsidy, typically when the customer applies, they have to provide eligibility documentation. The eligibility criteria is set by the FCC, but it's essentially a way for us as the stewards of program integrity to make sure that those who are applying are truly eligible. The FCC has been under really a lot of pressure, but also very interested in making sure that those who are not eligible are not getting the subsidy. There's just a lot of scrutiny on this program right now in Congress and really at the FCC. They just want to make sure that the benefit is being given to those who truly are eligible and qualify. So to qualify for the enhanced benefit of 3425, the customer has to demonstrate that they indeed live on a federally recognized tribal land or community. And I'll explain a little bit more about the address verification rules, but we need to verify that so that we can make sure that they truly do live in that community to be able to qualify for the enhanced subsidy. So what we do is we require the consumer to demonstrate that they live there by either providing some kind of official document that indicates an address. In Indian country, we know that a lot of people don't have addresses. In Alaska, you guys are not on the AMS system. We completely know that. So what we try to also do is make it so that consumers in Indian country that do not have a physical address, which is a lot of places, that they can actually hand draw a map and explain on the map, like, oh, I live here, and we will use that as a credible eligibility piece of information. We also have the ability for consumers to go into the Lifeline web portal and drop a pin in the area they think they live, and that'll automatically populate the application field on their application if they fill it out online. If they're submitting their application in paper form, they can just submit the application with the hand-drawn map. The other way that we allow for Native consumers to qualify and verify their address is they can provide a descriptive address. So in the address field online, they can say, I live near this mountain down the road near this other road. And that will populate the address field. Again, knowing full well that numerous people who have qualified for the subsidy do not have a physical address. So to qualify for the subsidy in total, you have to submit documentation to demonstrate you're eligible based on a number of core eligibility criteria. So to be eligible for Lifeline discounts off of your phone bill, you have to demonstrate you're either receiving SNAP or food distribution support, Medicaid, supplemental security income, the Veterans Pension Survivors Benefit. So if you receive Veterans Pension Survivors Benefits, you qualify. You also receive federal public housing support. So if you live in if you get tribal housing support, or if you live in a public housing facility, you have to provide documentation that you do indeed receive that level of support and that you live in a community that receives federal public housing assistance. The other criteria that we allow for consumers to use are those that are specifically for communities in tribal areas. So specifically Tribal TANF, Tribal Head Start, and the BIA General Assistance Program. So I want to reiterate here, you do not have to demonstrate you're in all those things. All you have to do as the customer is show you're in one, just one. So if you get Tribal TANF, you get SNAP, if you get food distribution support, all you have to do is show and provide documentation to us that you receive it, and you automatically qualify for the subsidy. The way the subsidy works is the phone company will discount the bill of the customer, and then we will essentially subsidize the carrier because they will submit documentation to us saying, this is the number of customers that we're serving who are eligible. And after the verification process has been completed, we will then be able to ensure that customer is receiving their discount off of their phone or internet bill. And we have a tool on our website as well. It's called the Companies Near Me tool. And at some point I'd like to do a demo to show you our online portal so you guys can see all the tools we have to make it really, really easy for folks to navigate. We try to make it as simple as possible, but feedback is always welcome on things we could make better and more intuitive. So we have a tool on our website where the customer can type in their zip code, and it'll list all the phone companies that they can choose that provide Lifeline discounts off of their phone bill in their area. So when my boss spoke at the AFN meeting last year, she showed the Companies Near Me tool, and she typed in a zip code and it showed the providers in that area, and that's really, I think, useful for the consumer to know that, again, it's another tool for the customer to know that they have options. They don't have to be tethered to one provider. An important piece to this discussion is the fact that Native consumers are not using this benefit, which is really sad to me because they qualify for the enhanced level of support. There's roughly 9.5 million consumers in this program nationwide today, and less than 270,000 of them are Native. So I was hoping that on this call, I could really call upon all of you to really help me get the word out. And I'm really grateful for the opportunity to speak with all of you today, but really do more to make sure that, everybody that's part of the U.N.I.T.E community can help us get more people in Indian country in this program and receiving the subsidy, because they all qualify for it, and we want to really help them. I've had discussions recently with some of the new leaders that work on the Navajo Nation. They were in Washington, and we met with Vice President Myron Leiser. And I said to him, we really want to get more people in Arizona, New Mexico, and Utah in the program. And there's just a fraction of consumers on your reservation that are using this benefit. And I think part of it is that elders have a hard time because I don't have translation capabilities to translate things in native languages. I mean, again, we're a nonprofit, so I don't have the resources to do that. What I do have the resources to do is try to figure out a way to work with all of you to get out there and conduct not just webinars, that's a one-way discussion, but having workshops at chapter houses and at community centers, and specifically speaking to directly to the Human Service Agency leaders in Native government. So, for example, Navajo, it's the Department of Self-Reliance. In other nations, it's like their Health and Human Services Agency. Again, this is a program that straddles the public and human services realm with telecommunications. So the eligibility criteria brings us directly in front of officials that administer tribal TANF, tribal Head Start, Medicaid, etc. I also wanted to mention a new eligibility verification process that we have been implementing nationwide. So historically, the phone companies were in charge of conducting all eligibility verifications for their customers. And over the years, they, spoke to the FCC to say, we don't want to do this anymore. We don't want to do attestation. It's too hard. It's not our job. We shouldn't be doing attestation anymore. So the FCC in 2016 adopted new federal rules to say that the phone companies are no longer required to do eligibility verification. Instead, my team at USAC would be doing it for all 56 states and territories. So our group at USAC in the Lifeline program are building out a nationwide, state-by-state verification process so that basically my group has built computer-to-computer connections to state databases to automate the verification process. So like when you apply for the Lifeline program in a particular state like New Mexico, my team can immediately send a query that's coded to the New Mexico Department of Human Services to say, is this customer eligible? Yes, no. And we would get a yes, no response back in terms of whether that person's receiving the benefit that they are receiving the federal benefits that they have claimed on their application. An important piece to know is that nothing can be verified unless the customer gives us consent. So on the application, we have a section that says, do you consent to having your status verified, utilizing your personal identifiable information? At USAC, my team, the program collects substantial amounts of PII. We have it on pretty much all 9.5 million consumers. So we have the first name, the last 4 digits of the Social Security number or tribal ID, their address, and their date of birth. What I don't have is whether or not they're receiving tribal TANF or whether they are eligible for food distribution. I have none of that. So that's what this eligibility verification process is trying to help my team solve. And what I've been trying to do is have a similar conversation about a computer-to-computer data computer matching agreement with tribes to see how we can help them improve the eligibility user experience when people apply for the Lifeline benefit instead of having to go through hell trying to, go through the paper process. So I guess I will stop there. I know I've thrown a lot at you, but I'm happy to take questions. And really, I know there's a ton of information. You guys are not telecommunications people per se, but the program and the eligibility requirements really bring us very closely aligned with the work you do. And we just are trying to figure out different ways to conduct outreach to get the number of consumers in any country applying and benefiting from this program, and not, agreeing to see the benefits of getting connectivity and really, understanding how it improves the quality of life for people. So I'll just stop there and take questions.
Do you have anything, Jessica, that you could send us that I might give to like our senior program?
Absolutely. Yep.
And stuff?
I can send you. Yes, ma'am. I can send you I have one-page document overview of what I just talked about. I also have a brochure for Native consumers and Native communities that I can also email you as well.
Okay, I would love to have that because I would take it to our appropriate departments that they could help people with.
And again, we're happy to go out there, right? I mean, I have a little bit of a budget to do travel and to spend time with people in the field and go to nursing homes, because tribal elders that are receiving these, that qualify for these federal support mechanisms qualify. And we just want to help them realize that and maybe use the program, to help themselves and to be successful in achieving connectivity.
Okay.
So, Jessica, this is Debbie Dijak. I have just a couple of questions. How often do you need to verify? Like, is that a yearly process? Also, the current tribes that you are working with, like when you talked about the contract. And then my third question is on the SNF, ALF, assisted living. Like, can you get everyone eligible? Like, could you come out and make everyone in the facility eligible? Because, like, how would that work if they were in a nursing home, like as a resident?
Yeah. So great questions. Thank you for those terrific, amazing questions. What you do is when you're a new applicant, you have to submit your documents. And then all you have to do every year is self-certify with us that you are still, eligible. It's a self-certification. So like other federal support programs, you have to certify that you're eligible every year. You don't have to submit all the documentation every year, just once. To the next question, does that make sense?
Yes.
Okay.
So they just call you. They just basically call you.
No, well, what they do is we allow, they can definitely do that. They can call, and I don't have a slide presentation to show you. I can walk you through how they can self-certify, which is fairly easy. We give them, we send out robocalls, we send out texts, we send out postcards. They can call our customer support center and do that. They can recertify that way. They can recertify with their phone company as well. So there's a variety of ways to do it. In terms of a skilled nursing facility or a multi-tenant dwelling, the benefit, so everyone has to apply individually. That's how it works. Now, if you're living in a household where everyone's sharing expenses, it's one benefit per household. I wanted to mention and reinforce that. And so when you're a family and you're sharing expenses, it's one benefit. If you're roommates, you both are eligible separately or multiple roommates to receive the benefit. And if you live in a multi-tenant dwelling, like a nursing home or a hospital or a homeless shelter in the case of, urbanized areas, or a VA medical facility, everyone in that facility has to either individually apply, recertify, but they all get the benefit instead of one person.
Hi, this is Susan Poyer. Can I say something?
Yeah.
I'm from the Pine Ridge Tribe. We've had this program for many, many years. Hi.
Yeah.
And we've had this program for years and years. And my son's a recipient. So we just go to the AT&T. We have to show his blood degree, and he gets Social Security disability, and that's it. And they do all the work for us at the AT&T office. And as far as our nursing home goes, our nursing home is in Nebraska. We had a difficult time there. What we had to do is we had to put their phones in, say their son has a box number. We use that box number, so our elders get the service also.
Right. No,
we
absolutely.
just go to AT&T and they do all the work for us.
Well, that may be right, but that's not the case everywhere. And there's a lot of carriers that just are not anywhere near the reservation. They don't have any office facilities. So, I'm just trying to give you guys a sense as to what's going on. Yeah. I mean, I would think, gosh, Pine Ridge, it must be really hard to get to the AT&T office. My goodness.
Well, we have transportation. Believe me, people get to the AT&T office.
I see. Well, that's great, and again, like, if there's a way we can help communities in Pine Ridge, like, learn about this benefit even more, I mean, we'll do it because, again, the number of consumers in Native communities getting the subsidy is a fraction of what it is nationally.
And I'll tell you what they're doing down here. What they're doing is they're going to say so-and-so's disabled, blah, 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 get the phone and give it to their granddaughter who lives in Basket or something.
Yeah, I mean, that sometimes happens, and unfortunately the FCC is trying to prevent that, but I wanted to just let you guys know, like, the basics and, like, give you, a feel for what's potentially possible and how to really navigate this program, and specifically how I personally can help, educate people back home in your communities about how to apply. So going back to your question, let's see. Let me see if I answered the first question.
I was asking, I'm sorry, this is Debbie, if you had any current contracts with tribes. You mentioned the computer match
the computer match agreements. Yeah, no, and I'm trying desperately to get them going. I've actually, to be honest with all of you, have had a very hard time with this because tribal healthcare executives are just they are a little reticent because they feel that they're not savvy on the telecommunications issues. And I try to explain to them, you don't have to be. It's not really something where you have to be necessarily an expert. It's just data that would enable us as the administrator to make it easier for everybody on Pine Ridge and everywhere else to qualify quickly. Because all the data that you're getting to AT&T has to come to me. It comes to me. So to make it easier, I'm trying to figure out how I can work with folks. And in Pine Ridge, there is no data source that I can work with that has all SNAP, Medicaid, Tribal TANF customers in one database that I could ping or leverage that would make it quick and automated. There's just no way. And in South Dakota, unfortunately, there's no data sources that I can use in an automated fashion. In other tribal communities, there are, and I have had conversations also with Coeur d'Alene and with Colville and others, and I'm just, I feel like it's just I'm not reaching them. I'm not making an impact for whatever reason. What I do try to impart with them is that when I verify the customer, I'm not pulling any data out of the database or the tribal, purview. What I'm doing essentially is sending a computer query from my computer, to the tribe's database saying, is customer 4567? It's a query. It's a computer query where I'm sending it into the tribal communities in the database asking, is this consumer eligible? Yes, no. And all I get back is a yes, no response back. There's no data that's getting pulled out. We're not housing data because the issue is that we have substantial PII already on all 9 million consumers. We don't want or need any more. We just are trying to find out from a credible data source at the tribal government level whether the consumer that is applying is indeed receiving those benefits so that we can move them quickly through the process. And I have no visibility into that, zero. And that's really my biggest challenge is when the FCC moved this entire verification process over to our team from the industry to us, we're just, trying to figure out how to build a attestation paradigm nationwide that will be, that easy, and we've done it already. We have agreements with 28 states so far. Many awesome, state human service agency folks are, they're pretty great and they get it. And we have automated connections, but what I do not have is anything with tribes. So I'm trying.
Well, thank you very much.
Thank you so much. Yeah.
Yeah,
thank you.
sure.
Appreciate your
does
time.
it make sense? I mean, yeah, absolutely. I mean, it's just, at the end of the day, if I have a computer matching agreement with a tribe, they'll just make the experience for the customer so much easier. They won't have to submit all this paperwork, you know what I mean? And they don't have to wait for like weeks. We could just quickly turn it around in seconds.
Yeah.
But down here at AT&T, you just go in with your ID, you get Social Security, and they give you your phone right there.
I know, but that phone number, as a customer, you have to verify your eligibility, and all that stuff comes back to my team. So,
yeah, but why
Right.
are you just giving us the phone that day and they're turned on?
well, they're giving you the phone. I don't know how maybe they're verifying your eligibility through some way of checking. I'm not sure how they're doing it, but they have to check it through USAC, through the Lifeline program. It's now federal law. Sorry,
So Susan, maybe you have a contact that you could give Jessica where she could reach out about this computer match agreement. I don't know if you know someone that you could give her a contact.
Yeah, like anybody on Pine Ridge, because the truth, we've been talking to some folks on Pine Ridge. I've also talked to Cheyenne River Sioux folks, and we would love to come out and train people. And we just don't know who to talk to.
Oh, well, I don't. Why? So why would we do this down here when we just go there and they do it for us?
You know why? Because the bulk of Pine Ridge consumers are not doing that. They don't know. They're falling off this program. Unfortunately, that's what's happening. Yeah, I mean, again, the numbers speak for themselves. Out of 9.5 million consumers, only less than 270,000 are Native in this nationwide subsidy program. So something's wrong. So that's why I was so glad that Deborah said, "Oh, please come and join my webinar." I mean, this is the kind of audience I really need to tap into. They don't know how to.
Right.
I'm trying to reverse the numbers.
Yeah,
So
that's a really good point, Jessica, that, sometimes like it's working for us, but we're not realizing how many people are eligible that aren't getting it. And so we just want to open those doors and make it as easy as possible.
Yes, Debbie, that is exactly the issue. It's that thousands and thousands of Native consumers are not using this program and don't know anything about it.
This is Lisa in Alaska. I'm wondering, do you have any kind of like a one-pager or something that I could just shoot out to my tribal nursing homes just to direct them to this information? That would be great.
Yes, and we can talk to the tribal the nursing home director. We could do anything to help them. I mean, I don't know if I have the ability to go back out to Alaska. We were there last year and it was lovely, and we had a lovely time. And my colleague spoke at AFN, but it's really interesting. We went to AFN and apparently nobody showed up to our workshop.
Gosh, I was thinking that was a perfect audience, the perfect place for you to be, but nobody came.
Nobody came.
Man, I hate having a party when nobody shows up.
The room was empty.
Wow. Well, you know what that maybe tells me is that, again, going back to your people don't know what they don't know, just not having an awareness that this program's out there and that there's really a lot of benefit for them. So, I'd be happy to share some information with my nursing home group if that'll help.
Oh yeah, please. Anything you guys can do to help me, because it's just we can't let this continue where people are, getting discouraged. Like most displaced consumers, they get discouraged and they just don't want to follow through. They get annoyed. And that's why I try to explain to the tribal health and human services staff, like, if I could just get a way to automate and do a computer matching agreement with them, it would be a humongous benefit because more people on the tribe would get the subsidy, not less, because they'd be like, oh, this is so much easier than we thought.
Jessica, in general, how much of a savings is there? If I was a tribal elder, living in a nursing home, what would typically be a savings for me?
Sure. So if you get a cell phone plan, I mean, they vary, right? They vary in terms of value. They vary in terms of the phone, the number of minutes, the cost. And the average cell phone plan, I mean, this is $34 off of your, bill. So if your bill is $50, you're saving $34 off of a $50 bill.
Okay. And that's for anyone living on a tribal land, including a tribal nursing home. Okay.
Correct.
Okay. If you send me those resources, because I'm not sure you have everyone's email, if you send them to me, then I will make sure that they get into our newsletter and also that everyone that is spoken up today gets them.
I really appreciate it. I really appreciate it.
I do have one quick question about Alaska, because when we talk about tribal land, of course, I think of a reservation, which we don't have that situation here in our state. So are there some nuances that might affect our Alaska Native population?
The entire state of Alaska, according to federal policy and law, is deemed rural and deemed native, right? So the entire state qualifies for 3425.
Nice. Okay, thank you.
You got it. But I mean, a lot of Alaska Native a lot of Alaska Native villagers don't even know. And what we've learned is that a lot of Alaska Native communities, they don't have addresses, just like every other community in the lower 48. So, we're just trying to get them to realize, like, oh gosh, how do they, maybe they got to send. The problem is without a computer connection, you've got to mail all that stuff back to us somehow. And I know sometimes the mail comes once a week in a lot of communities, so it's really slow.
That's true, and you're right. We don't always have physical addresses, so I'm sure that is a challenge. But, interesting. I'll definitely be looking forward to sharing this info.
Cool. Thank you.
All right.
Any other questions? Well, Debbie, thank you for including me. And I just want to reiterate to everybody, feel free to, and I will include my contact information. Please, reach out to me and, let me know what I can do here at USAC to help you. In my view, any little bit helps. Any subsidy program that doesn't come out of your bucket helps. So, help me try to get the word out, and that's all I ask.
Yeah, thank you very much, Jessica. We really appreciate your being on our call. It's very helpful.
Oh, it's my pleasure, and we're happy to be on the next one. I'm sorry it took so long to get me on here, but always willing to help Native elders any way I can.
Yes, and that's our goal. That's our mission and goal too. So I think we really share that. So that's great. All right,
awesome.
Tammy, thank you.
Thank you.
Okay, so we'll move on. Are there any updates on NICOA? NCAI?
No, I sent out a document that Elaine Seep sent to us on the Older Americans Act reauthorization. I sent that to Julie yesterday to put into our July newsletter, just so you know. It just came out.
Okay. And when do we need things in to put in the newsletter again?
So it's always the first Wednesday of the month. So I know there's a holiday this month, but they try to send the newsletter out the week before our call, and our call is always the third Thursday. So, for example, in July, our call will be on the 18th. So the newsletter will come out on the 11th. So the deadline is that Wednesday before, which would be the 3rd. Okay. So try to get any newsletter items to KAI by the 3rd. And then the 4th Wednesday is the LTSS webinar, the long-term support service webinar. So it's kind of like every month there's something going on, you know, at least 4 times in that month.
Okay, thanks. Anything on GWEP?
I think Lee, I just saw that Lee sent a letter of support from the University of Arizona GWEP, which is great. I mean,
Right.
Dr. Lewis, Jordan Lewis, I mean, they have a GWEP, right, Lisa, in Alaska?
Well,
Usually I'm on the
yes
call.
and no. Oh, is Jordan on the call?
No, Lee.
No, Francis is on the call.
Oh, yay.
Hi, yes. We do have a new GWEP. So the University of Alaska Anchorage was partnering with the Alaska Native Medical Center to oversee that work the last go round. They do have a new GWEP person over, I believe, just at the hospital. And I've made contact a few times, but we haven't actually connected.
Okay. All right.
Okay. How about
So
any
we
report on
wouldn't really
QIO?
know them, Lisa, in terms of a letter of support.
Probably not.
Okay. Okay.
I know Dr. Lewis did send out a letter, though.
Okay, great. And I did send out the 3 letters from last summer that we got when we did our advocacy work on the Senate Heart Building, that we got 3 letters of support, including one from Lisa's QIO, and I did send those earlier to Susan, so hopefully, Jared, you got those.
Great.
Yes, I've got those.
Okay, good.
So, anything on QIOs?
Lisa can speak. I mean, we're basically at Health Services Advisory Group, which I'm now employed there. We're working with, we're looking at the next, what they call the scope of work, which is basically the next federal contract. So we're just kind of, just getting started with, I mean, I'm sure there'll be a lot of work with nursing homes with opioid use, with also readmissions and some patient safety issues. So those are some of the things that are coming down the pipe, just for FYI.
Debbie, this is Lee. Can you make any if you're submitting it as an application, right? For funding for the HSAG. Like we contract with CMS, so there was a whole bidding process earlier this year. So would it not make sense then to have, maybe you already said this and I missed it, have sort of an agreement or whatever with U.N.I.T.E to work with U.N.I.T.E, and that can also be then put in the proposal being submitted?
So, Lee, there was some talk. I had a talk with Barb Averett. She's our executive director.
Yeah.
So she's aware of U.N.I.T.E and what we're doing because I, let them know. I don't know specifically. I believe there were things there with rural and, underserved type, populations. So I think it's going to fit, but I don't have at my level access to all the specific written documents that were forwarded. So I'm not 100% sure. But I know that there's...
This is Lisa. I just want to jump in and say I know at least in Alaska, what I've seen, what I've been privy to, did have mention of tribal facilities and working with. It was definitely called out in at least the contract response that I saw. But I do think it's going to be a lot leaner of a contract, and we're going to be tasked with some pretty tough work, but I also think that U.N.I.T.E is a great vehicle to help make that happen.
Yeah, I would agree with that. So I'll know more, Lee, probably toward the middle of July. I'll know a lot more.
Well, I don't know if I was clear on what I asked. All I'm saying is that a letter from the HSAG of support, but include in that there's an affiliation with U.N.I.T.E to support its work, or vice versa, that you would work with U.N.I.T.E. That's all.
Yeah. So
you could be specific. You could be specific as to the kinds of things that HSAG can do with U.N.I.T.E to further a positive impression of the resources that can be made available through U.N.I.T.E.
Yes, and
Does that
Lee,
make sense?
I will definitely request that. I don't think that'll be a problem by the end of next week, but I'll make that request.
Okay. Thanks.
Thank you.
Thank you. So any reports on ombudsman?
I don't. Is someone supposed to be reporting on it?
Well, we just usually go over any updates if there's any new news we know.
Lisa, I think Teresa Holt in Alaska, did she retire or move jobs? Is that what happened?
No, she's still with us. She's been traveling a lot, I know, the last couple months.
Oh, yeah. Okay. I thought she sent me an email saying she wasn't doing what she was doing anymore. So if we could get her back on the calls, that would be great because I know she always knew what was happening in that world.
Yeah, the ombudsman, yeah.
Okay.
I'll reach out to her. We usually have a face-to-face on the last Tuesday of the month, and she's tentatively accepted, so I'll ask her when I see her.
Okay, that'd be great.
Thank you. Anything else, Jonathan, you want to add with KAI?
No, I don't have any other updates.
Okay. Administrators, I don't have anything to add.
Okay.
Board members, anything else that you want to discuss for this meeting? And we have tribal assisted living facilities. I don't think we have any representation from there, do we, today?
I don't think so, but as I mentioned, KAI is updating the tribal list of assisted livings, and that will be on CMS.gov soon.
Okay. We've already discussed quite a few opportunities for advocacy, and then we already discussed planning of the annual meeting. So is there any other new business? I'm wondering, since all of us are on this call, and Jonathan, I don't know if this is okay, but we did not get to complete our board of directors meeting. Would it be possible for those of us that are on the board of directors to stay on this line so we can just finish our meeting, or would you like to prefer we hang up?
The line, as far as I know, the line should stay open. So if you want to continue, that should be fine.
Okay, does everybody want to do that, or do you want to all hang up and call Ron's number?
I think this is fine if we can use it. If it goes dead, we should call Ron's number.
Okay, so Francis and Lee, the number, if we get disconnected, to call back.
Yeah, I have some other call, but you're welcome to.
Yeah, can you give that number, please?
Yes, it's 605-468-8010. Access code 523184 pound.
Is that it?
That's it. So if there's no further business, this meeting is adjourned. I thank the rest of you for joining, and we will go back to our board of directors meeting.
Thanks, everybody. Bye.
Thank you.
Bye.
Thank you, Jessica.
Bye.
Are we still on?
I am.
Oh,
Yeah,
good.
I think we're good.
Okay. So, we did not get to complete discussion about the search committee report, and I think that we have several things we need to vote on as a board. We did have a search committee meeting yesterday. I sent everyone a copy of the updated job descriptions. We made a change that he had. Debbie wanted to know about item 3, that promote active and broad participation by tribes and urban Indian programs in all areas of the organization's work.
No, I'm sorry, Tammy. It was the one where it talked about staffing. It was the third bullet point under staffing. The way that was written made just no sense to me.
What's it say? I don't have
I can look it up real quick
It
on
says
my.
encourage staff in volunteer development and education and assist program staff in relating their specialized work to the total program of the organization.
I don't get that. I don't know exactly. It sounds like a lot of words. I'm not quite sure what we're trying to say with that.
Can you repeat it one more time?
Okay, it says encourage staff and volunteer development and education and assist program staff in relating their specialized work to the total program of the organization. So to me, what that means is you would encourage anyone that was helping with U.N.I.T E, whether they were a staff member or volunteer, on development and education, and we're trying to assist staff in relating their specialty to help our organization. That's how I read it.
Mm-hmm.
I don't know if there's some way to just condense, but if we could just, I don't know, it just seems like we could condense that down a little bit. Like the executive director will work with any, volunteer or paid staff to, promote the vision and mission of the organization. Just something real simple. It just sounded very complicated.
Well, why don't you rewrite the sentence and send it to her?
Yeah, just email it to me and I'll just put that in.
Okay, that's fine.
Does anyone else have any other changes they'd like to see? We did vote yesterday with the search committee to require a bachelor's degree. And then we listed everything else on experience required. So if there's no other additions or changes, can we take a vote whether to approve this job description?
This is Ron. I'll make a motion to approve that job description.
With the update I'm sending, Tammy. Yeah.
Sure.
With the change included.
Yeah.
Lee seconds it.
Okay. All those in favor say aye.
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 Any opposed? Nay? Okay, so the job description is dealt with. And then we talked briefly in our meeting a little bit ago about location of where this person would be. Ron explained to us the in-kind match, and he had offered his office at Lincoln. And Ron, do you want to say anything about that?
Well, again, makes no difference to us where it's at. It's just in order to prepare for the grant, we had to come up with a way of coming up with about $66,000 worth of in-kind support. And it was the best that we could come up with at the time. It's certainly if somebody else has some ideas on how to do that, but we've got to get the budget in. If we're going to ask for $200,000, we got to come up with $66,000 of in-kind. I do think we did put in some professional service as part of the in-kind, and I would think that several of us on the board would be able to provide that professional service. But that's where we got to where we are. And as Jared mentioned earlier, down the road, we want to put this someplace else. We sure can. We're just trying to help get it off the ground.
No, that's appreciated, Ron. I think
so too.
I think for the timing and the circumstances that keeping it there would make the most sense. Do you know, I don't know if Jared's on the call or not, but do you know what the balance of in-kind that's needed, or capture in-kind is needed at this point if you calculated I don't have the budget in front of me, if you calculate in with office value and what have you?
If you calculate with the office value? Yeah,
no, in other words,
we have a total of
$70,000
is what I have proposed.
Okay. And how far along are we?
Well, So the budget right now, it does come up to 70.
Okay. And what is the amount we were going to match at 20? Is it 25? Is it 25% or something?
25%.
And 25% of the, was it 250?
Well, 25% of 200,000.
Of 200,000.
And so we need little over 66,000. So I try to make it 70. So that's where we would certainly be okay.
And how close are we to 70, or are we at 70?
We are at 70.
Okay. So why don't we kind of take care of that as it is, and it's one less thing for us to try to, or you, to pull your hair out with. If we have the right in kind at the moment and everything else, then I would just stick with it. And I think everybody appreciate what you and Ron are doing, and that if in fact there is another location for the offices, that's great because it can happen once things are established. That's
I agree. Would someone make a motion to approve the executive director being placed at the Lincoln office?
I so moved, Lee.
I'll second that to get us started.
Thank you. All those in favor say aye.
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 Any opposed? Okay, great. That's carried, so that's one less thing out of our hair. I agree, Lee.
Mm-hmm.
So then we talk about advertising. Ron?
Right.
Able to come up with some money in the form of dues. However, the discussion kind of led a bit of discussion about, Susan's already on the board, that it might be assumed she would just take the position. To me, if that was the case, then it would be a waste of time to advertise. So my question to all of you is a vote on, do you want to advertise this position or not?
Yes.
Who's speaking? Can you guys say who's speaking? Because I'm not I'm differentiating.
This is Susan. I think we should advertise.
Okay. Okay.
Is there a motion to advertise this position?
So Tammy, hold on a second. So Susan, are you interested in the position of executive director for U.N.I.T.E?
Well, yes, but I would still like everybody. I mean, I would like it to be advertised.
Okay.
Yeah, I mean, you know.
I mean, so I'm just going to put in my 2 cents. I think it's important to advertise it also because, I mean, like I've been here at AZ Healthcare Association meeting the last 2 or 3 days, and there were some people here that honestly were interested in the position. And I just think that there's, you know, I don't know, you know, we have to make the best decision, obviously, but I think it's always good to kind of get a feel for where everyone is and what they have to offer the organization.
So is there a motion to advertise?
No, but I need one.
I'll make a motion to advertise.
Okay, thank you. All those in favor of advertising, say yay.
Yes.
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 I agree. Yes.
Okay. Any opposed? Okay, great. So that solves that. We will get this, and Corey is going to help me get it out. Try to get it in several places, I hope, across Indian country.
Who seconded the motion?
Ina?
Okay. Okay.
So I think that will wrap up the job search stuff that started going there then.
Okay.
Does anyone have any other questions about it?
No.
No.
Oh, something I did want to add, because Val Friel was on the search committee. And I mentioned yesterday I was very concerned because I had tried to get a hold of him with no response. If anyone didn't hear it on the call today, he did retire. He is no longer the administrator.
Yeah, that's what I found.
Lisa is going to try to get us new contact information so we can try to get people in Alaska, back on the board or back involved with us or something. But that was the case now, so committee is down.
Is Val no longer on U.N.I.T.E board?
I don't know. I didn't have time to call him today, Debbie, but I will.
Okay.
To see where he's at.
Ron, for our nonprofit, if somebody needs to leave the board, do we need a letter or something in writing?
Yes, we would need. Yeah, we would. So I guess after Tammy reaches out to Val, we'll know more about what his intentions are. But if he's not going to stay involved, he probably should send a written termination to Tammy.
Okay, I will bring that up with him when I find out what his plan is. I hope that he will stay with us because he has a lot of good knowledge too.
Yeah. We can also ask him if he has any suggestions for anyone else from Alaska.
Yeah.
Yeah.
Absolutely.
And I have one more question. With the executive director position, could they work remotely, or are we asking them to be at the Nebraska office for right now?
Question.
I think that would depend on the circumstances. You know, let's see what who the candidates are and who the board finally votes on. That would there's probably a lot of stuff that could be done remotely. But I think if we have some staff people, the staff people obviously are going to need to be where they can create the data and do some outreach. So I think that question's up in the air.
Okay.
I agree.
Okay.
Yeah.
Any other questions about it?
No.
That's good.
Okay. Well, thank you guys. I'm going to adjourn this meeting then. Hope everyone has a good week, and hope all of us get to go to the Leading Age Conference or annual meeting.
Start planning now.
I'll get the minutes out tomorrow. I have to be in Rapid to go get my allergy shot.
Okay.
Okay. Get your allergies.
Good luck with that.
Good evening.
Yeah.
All right. Take care, everyone.
Bye-bye.
Bye.
Hey, bye-bye.
Thank you.
Bye all.
Thank you.